Are you turning 65 and totally overwhelmed and confused about your Medicare options? And you just decide, well, I guess I'll probably go with this Advantage plan over here because it looks like what I've had before. And besides, nobody's really talking to me about original Medicare. Well, I'm going to talk to you about it today. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. All right, a lot of folks look at the Medicare Advantage plans and they say, gosh, this thing looks like it's really, really good. There's no premium to a lot of these plans. They've got dental and vision and yeah, it's got some networks in there, but I've already checked and my doctors are in network. Okay, well, that's fine. What about your future doctors, the ones that you're going to need at some point down the road when maybe you get a cancer diagnosis or you've got serious heart conditions or maybe you're even in a bad accident and you need some kind of specialist care? What are you going to do in those situations? Well, I hadn't really thought about that. Well, now's the time to think about it as opposed to waiting till the point where you have claims coming up, your health has changed, and you're stuck in a Medicare Advantage plan, and you decide, I don't really like this, and besides that, I can't afford it. Oh, what do you mean you can't afford it? There's no premium to it. That's true. There's no premium to it. But there's the people who told you about the Medicare Advantage plan, they talked about, well, it's got a zero copay or a $10 or $20, $30, $40 copay. And they didn't really talk about that 20% side. Yeah, the 20% is when you get into things like physical therapy, chemotherapy, radiation therapy, psychotherapy, as well as some drugs, generally the ones that are given to you by infusion. Those claims are not a copay most of the time. They're usually 20%. Well, 20% of what? Well, that's the question. And you would pay 20% until either you're better or you've hit your out-of-pocket maximum on your Advantage plan. What's your out-of-pocket maximum? Most of the time it's going to be somewhere between $5,000 and $8,000. So, people don't talk about that, but I do. And that's something to think about. What about original Medicare? Original Medicare doesn't have any networks. You could go to any doctor, any hospital, anywhere in the country that participates in Medicare. And that's just about all of them. You don't have prior authorizations. And when paired with a Medicare supplement plan, your out-of-pocket can typically be less than $300 a year. Now, that is something to think about. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.